This shampoo is used to treat dandruff and a certain scalp infection known as seborrheic dermatitis. It helps to reduce itching, flaking, irritation, and redness of the scalp. Selenium sulfide is also used for a condition that causes discoloration of the skin called tinea versicolor. This shampoo belongs to a class of medications called anti-infectives, and it works by slowing the growth of the yeast that causes the infection. Use this shampoo as directed by your doctor or pharmacist. Apply it to wet hair, lather and massage into the scalp, then rinse thoroughly. It is usually recommended to use this shampoo twice a week for the first 2 weeks, then once a week thereafter to maintain results. Remember to avoid getting it in your eyes, nose, or mouth, and do not use it on broken or inflamed skin. When using Selenium Sulfide-Aloe Vera Shampoo, it is important to remember that this medication is for use on the skin only. Some brands may need to be shaken before use, so be sure to check the product package to see if this applies to your brand. Before applying the shampoo, remove any jewelry to avoid damage and be careful to avoid getting the medication into your eyes, nose, mouth, or on any broken or inflamed skin, as it may cause irritation. If this happens, simply flush the area with plenty of water. For the treatment of dandruff or scalp dermatitis, follow the manufacturer's instructions or use as directed by your doctor. Wet the scalp and massage the medication onto the wet scalp, leaving it on for 2 to 3 minutes before rinsing thoroughly. Some brands may require a second application, so be sure to check the product package for any specific instructions. Rinse your hair and scalp well with water after each application, especially if you have bleached, tinted, or permed hair. This medication is typically used 1 or 2 times per week for dandruff or seborrheic dermatitis, or less often to maintain control of dandruff. If you are using selenium sulfide for the treatment of tinea versicolor, apply it to the affected skin, lather with a small amount of water, and leave it on for 10 minutes before rinsing thoroughly with water. Be sure to rinse the genital areas or skin folds well if the medication touches those areas, to prevent irritation. This medication is usually applied once daily for 7 days to treat tinea versicolor, or as directed by your doctor. After using selenium sulfide, remember to wash your hands. It is important not to leave the medication on your hair, scalp, or skin for longer than directed, or to use it more often than directed. Doing so will not clear your condition faster, but may increase the risk of side effects. If your condition worsens or does not improve, be sure to consult your doctor or pharmacist promptly. If you experience skin irritation, dry skin, or temporary hair loss, you should stop using this shampoo and consult your doctor or pharmacist. Hair discoloration may occur, but can be reduced by thoroughly rinsing your hair after each treatment. If your doctor has prescribed this shampoo, it means they have determined that the benefits outweigh the risks. Most people using this shampoo do not experience serious side effects. Although it is very rare, a serious allergic reaction can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Before using Selenium Sulfide-Aloe Vera Shampoo, it's important to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, it's important to inform your doctor or pharmacist about your medical history, especially if you have red, irritated, or broken skin. This medication is not recommended for children younger than 2 years old, so it's important to consult your doctor before using it on children. If you are using Selenium Sulfide-Aloe Vera Shampoo for tinea versicolor during pregnancy, it should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. Though there have been no reports of harm to nursing infants, it's still important to discuss this with your doctor. When using Selenium Sulfide-Aloe Vera Shampoo, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Selenium Sulfide-Aloe Vera Shampoo. If this shampoo is accidentally swallowed, it can be harmful. If someone has overdosed and is experiencing serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Make sure to keep all your medical and lab appointments to ensure that your condition is being monitored closely and that the treatment is effective. This will also allow your healthcare provider to make any necessary adjustments to your treatment plan. If you forget to use this shampoo, just use it as soon as you remember. But if it's almost time for your next use, then skip the missed dose. Just use the next dose at your regular time. Don't use extra shampoo to make up for the missed dose. Make sure to store the Selenium Sulfide-Aloe Vera Shampoo at room temperature and avoid freezing. Keep it out of reach of children and pets. It's important not to flush the shampoo down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.